Dear friends and colleagues, ladies and gentlemen, welcome to the preview from the Thoraxcenter of the 2021 AHA meeting. My name is Nicolas from Mieghem from the Erasmus University Medical Center, and it's my pleasure as always to do this preview together with my good friend and colleague Joost Daemen. Again, we'll talk about the AHA. So many trials will be presented. We made a very small selection of the trials that are of interest to us. I can maybe start with the AVATAR trial. So the AVATAR trial is a study focusing on patients with asymptomatic severe aortic stenosis. It's a relatively small trial, including only 157 patients from 9 countries and 14 centers. The inclusion time took long, 6 years, but still I believe this trial is of interest because patients were only eligible if they had truly asymptomatic severe aortic stenosis. And also they should not have a depressed LV function, so ejection fraction had to be above 50%, and they had to have a negative stress test, because otherwise, of course, the guidelines already recommend a valve replacement. Well, the primary endpoint at 3 years is a composite of death, MI, stroke, and unplanned cardiovascular hospitalization. And I think this is a trial that hopefully will be positive, because it makes sense that an early intervention based on the data that we have so far will have a clinical benefit. Also because surgery in this day and age is a relatively safe procedure. But I would already predict that this also will ask for the question, what about then a TAVI treatment for those patients? So we'll see what the mean age of these patients is and the operative risk. But of course, why would you do surgery if maybe also TAVI would be a less invasive and safe alternative? So let's see, and this trial probably will also beg for the outcome of the early TAVR trial, which is a study that is 10 times as large in terms of patient enrollments. Another trial in the surgical sphere is the SpiritHCM Trial. This is a study that is looking at quality of life and functional status of patients after a surgical myectomy for patients with hypertrophic cardiomyopathy. I think this is a very interesting study, and we do have to realize that in hypertrophic cardiomyopathy, the scientific data is a little bit underwhelming. So this is very relevant data coming from the Cleveland Clinic. So I would be very interested in the outcome, and I would assume that in the patients that were eligible for this study, being between 18 and 65 years old, they should be able to recover from surgery and therefore feel the benefit of a myectomy. But also here, there is these days also a less invasive alternative. This is the alcohol ablation. So probably that will also be one of the questions. Okay, but would we have the same results if we would have done an alcohol ablation? So maybe more questions than answers after the presentation of these two surgical trials.
Something for the wrap-up.
But there, exactly. But there is another interesting trial on Cabbage that's going to be presented.
Yeah, so what will be presented is the Rapid Titrate Cabbage trial, which is a randomized Canadian trial which enrolled up to, I think, 140 ACS patients from multiple sites in Canada that were preloaded with ticagrelor and were deemed to undergo surgery. And these patients were then one-to-one randomized to either early surgery, meaning surgery within 2 to 3 days of this after discontinuation of ticagrelor, versus a longer prolongation, so 5 to 7 days discontinuation of ticagrelor and only then surgery, with a primary endpoint of severe or massive bleeding, which you would assume could be met theoretically. Knowing that at present there are a lot of surgeons who are still very reluctant to operate these patients under ticagrelor. Conversely, we also know that in these days we are perhaps starting to get a bit more reluctant with preloading all these patients. With prasugrel we no longer do it. With ticagrelor also the benefit is perhaps not there, and I think that could be a case for waiting up until you have confirmed the anatomy with starting your ticagrelor.
Yeah, and the most recent ESC guidelines recommend against preloading patients, even with ticagrelor. So this study is clinically very very relevant. I mean, the context, we all are very much aware of the context, but maybe this trial was a year too late, maybe.
Maybe, but I think it would settle the issue.
Yes, and it would also be nice if there were a drug to counteract the ticagrelor, to counterbalance, to neutralize it.
Exactly, and that's a nice bridge to the next presentation that will be done by Deepak Bhatt, which is the Reverse It trial. So this is a trial studying the effects of bentrazimab, which is a platelet inhibition agent that will reverse the effects of ticagrelor. And in this trial, which is an open label study, patients who have undergone treatment with ticagrelor and are in need of urgent surgery or uncontrolled hemorrhage are enrolled in these studies and will get bentrazimab according to a predefined protocol of an early loading dose, which should reverse the effect in 90 to 95% of the cases already, and then also a prolonged dosage for up to, I think, 16 hours. And in this trial, the investigators will look as a primary endpoint at platelet reactivity units, so being the active, direct, measurable reversal effect of the drug, as compared also to the bleedings that might still occur and also the feasibility of the urgent surgery. So very interesting in an era where I think ticagrelor still has an important role.
Absolutely. Absolutely.
More on a completely different topic. In the COVID era, which is still, as you all know, very relevant, a study from the US P-Cornet blood pressure registry. Completely different topic, but an interesting one. It's a 2,000 patient randomized controlled trial in which 2,000 hypertensive patients will be randomized to either a home blood pressure monitor and then standard of care, so contact your physician in case needed, versus home blood pressure monitor plus an app which will directly receive the data from the home blood pressure monitor and be in direct contact with the physician guiding or treating the blood pressure. And as the title suggests of this abstract, this study will focus on how COVID actually disrupted the routine care of blood pressure control and how many cases now are off target in this era. And that in perspective to both treatment strategies. So to me, very interesting. First, because it adds to the potential benefit of these wearables as adjunct technologies to optimize treatment control. And on the other hand, it might also be an additional food for thought to drive the adoption of non-pharmacological treatment strategies for hypertension with a continuously on effect, like, for instance, renal denervation.
Absolutely, absolutely. And also of interest, of course, that this is more also fits within the concept of digital health.
Absolutely,
course, right?
absolutely.
Yeah. Okay,
finally,
there is the Cosmos study, and the Cosmos study is a study that I have some sympathy for the concept, because it studies basically the effects of cocoa on cardiovascular health. And,
you know that's chocolate, not Coca-Cola.
I am an addict on Coca-Cola, but also in chocolate. But obviously, it is derived from cocoa, but it is the flavonoids that are basically lost during the production process of chocolate, unfortunately. But that said, investigators from the Brigham and Women's, but also from a renowned cancer institute, the Fred Hutchinson Cancer Research Center in Seattle, they teamed up and designed this huge trial with over 20,000 patients, and they have a 2x2 design where patients will be randomized to receiving this cocoa-derived drug, if you will, in combination or not in combination with multivitamins. So we have a 2x2 design. I'm very interested in their primary endpoint, which is basically a composite of cardiovascular death, MI, stroke, coronary vascularization, or carotid or peripheral intervention. There is also a co-primary oncological endpoint in terms of the incidence of invasive cancer. So I think highly interesting. It would be cool if this would be a positive study, but if not,
21,000 patients, so there is a likelihood, but I'm curious.
Well, worst case scenario, it won't do anything, but I don't expect any harm either.
That is the downside.
Okay.
The opposite side. Absolutely.
Okay. With that, I think we can wrap up the preview of AHA. We look forward to the results of these studies, and we also thank you for staying with us in this preview, and we look forward to discussing in a week or so after AHA.
Thank you. Bye-bye.
Bye.